COVID-19 first broke out in 2019. The virus caused COVID-19 pandemic to spread across the world. On December 2020, there were 73 million infected, 48 million recovered, and 1.6 million deaths around the world. While the pandemic is still happening, there have been warnings about the possibility of twindemic, where the flu season and the period of another COVID-19 spike appears simultaneously. Why twindemic is dangerous? The main reason is that both COVID-19 and flu have similar symptoms. Symptoms for both COVID-19 and flu are fever, coughs, and headache. However, their causes and treatments are different. While flu can be prevented with vaccine and treated in medicines, there is no medicine for COVID-19. In other words, during the twindemic, it's important to distinguish COVID-19 and flu to give appropriate treatment and preventive measures. Therefore, we will talk about the following guideline for preventing and avoiding the spread of COVID-19. First, wash your hands often with soap and water. Cover to avoid aerosols while coughing or sneezing using the inside of your elbow. Do not touch your eyes, nose, and mouth with unwashed hands. Always wear a mask whenever you go out. Avoid visiting a crowded place. Keep about 6 feet between you and others. Do not go near anyone showing symptoms of fever and respiratory signs. What should you do when you think you have COVID-19? If you have been in a close contact with someone having COVID-19 or present in an area with a high risk of SARS-CoV-2 infection, you would have to stay at home and monitor yourself for 2 weeks. The very first thing you should do is to call 911 and follow their instructions. You can visit the designated local emergency facility for COVID-19. Always call before you go. Always wear a mask while visiting the facility or consulting the doctor. Do not use public transportation services such as taxis and buses to avoid contact with others. Respiratory samples will be collected for testing COVID-19. Either antigen or molecular diagnostic tests will be done following the authority regulations, which will differ from country to country. Follow the appropriate guidelines according to the results of your PCR test. If the results show negative on both COVID and flu, you can still live your ordinary life, but you will still need to follow the COVID-19 prevention guidelines. If the results show negative on COVID-19 but positive on flu, you will need to take antiviral drugs prescribed by the healthcare provider. If the results show positive on COVID-19 but your symptoms are still light, you must follow the authorities' instructions and stay at home. If the results show positive on COVID-19 and you're experiencing serious symptoms, you'll need to be hospitalized for proper treatments. Ultimately, in case of twindemic, appropriate preventive and treatment measures must be taken according to the accurate test results. Then what kind of tests should we do to diagnose both diseases accurately? During the case of COVID-19, we must aim to properly distinguish the infected population and isolate them. Usually, 2 types of diagnostic tests are used for COVID-19. Antigen diagnosis. Antigen diagnostics can detect specific proteins from the virus. It is possible to test for the early viral infection, but its accuracy is only 50 to 70%. It takes less than an hour. Molecular diagnostic tests. Molecular diagnostic tests use viral genetic material through multiple amplification cycles. It is possible to test for the early viral infection with over 95% of its accuracy. It takes less than 4 hours. Therefore, PCR is the best solution for distinguishing flu and COVID-19 with its high sensitivity and specificity. If the population for COVID-19 tests are limited in a community, the risk of spread increases drastically as there is no way to distinguish the infected. On the other hand, if the number of people testing for COVID-19 increases, isolation will be done quicker, resulting in more efficient control. It is important to screen suspected patients as much as possible to prevent the spread of COVID-19. BIONEER can provide the best solution for preventing the spread of COVID-19. First, BIONEER has a rich experience in handling global infection crisis. Second, BIONEER has developed its own unique molecular diagnostic system, providing the most optimized system based on the laboratory's condition. BIONEER's molecular diagnostic system has a high throughput that can undergo multiple analyses easily at once. Third, BIONEER can provide diagnostic systems that can test COVID-19 and flu simultaneously. With this, patients can avoid any unnecessary visits to the hospitals. As the two diseases can be monitored at once, users can save their time and efforts along with systematic management.